My name is Dr. Larry Mullins. I'm President and Chief Executive Officer of Samaritan Health Services. Over the years, I've had the opportunity in my positions to see a lot of health care being delivered, and there seemed to be a constant theme throughout it that people had a need in the mental health arena, and perhaps we just didn't have all the resources that we should have to help provide care to them and also to their family members. I'm very fortunate that the Mullins Charitable Fund actually started because of the generosity and the graciousness of my governing board, that when I completed some graduate studies for my doctoral program some years back, they endowed a scholarship funding program for people that were pursuing the healthcare field. That program has been very successful for many years now, and we decided to expand upon that and also provide some direct services that were also educational and informative to the public in the area of children's health and in mental health services.
I actually heard about the Mullins Charitable Funds when I was 16. I did a health occupations internship, and so I talked with Skip Panter a lot. That was through Crescent Valley High School, and he told me about it back then. Nowadays, I feel like students can't just go to school. They have to work, and they have a lot of other things on their plate too.
$50,000 is a lot of money for a year of school. Scholarship has helped take a little bit of the burden off, knowing that I'm not going to have to pay that money back in the future, and it's taken a little bit of the stress off of the fact that I'm going to be $150,000 in debt by the time I'm done.
If I didn't have the scholarship, I would have worked a lot more and not had as much time with my son, and I wouldn't have been able to do as many cooperative work experiences, which are like mini internships in the nursing profession. I really was able to get a well-rounded education because I had so much free time to do the CWEs.
The mental health first aid course really gave me the confidence to not only recognize something that might be a mental health disorder, but also maybe approach a person or handle a situation that needs to be de-escalated. If we can provide first aid for someone with a broken arm, why can't we still do that same thing with someone who says, I'm going to kill myself or I'm depressed?
Mental health plays into every aspect of society, in my opinion. It's something I frequently deal with in the nursing profession as well.
You look at some of the communities, most of the homeless population, most of the prison population, they've all got mental health issues. And the way we're treating it now, it's not working.
Probably literally 2 days after the training, we had a lady call into the call center, and she said that she was going to kill herself. Now, before that training, I would have had a difficult time dealing with that situation. But with the training, it gave me the confidence and basically the know-how to how to approach and how to de-escalate the situation.
I was surprised to find out that shortly after I took the class, it actually benefited me in my personal life. I have a family friend, and I could tell that she was really struggling and not seeming quite herself. And so when we pulled up in front of her house, I was able to turn and look at her and asked her if she was thinking of hurting herself. And she looked me in the eye and said, yes, she was. Then I was able to go in and have a conversation with her mom, and we were able to get her some professional help, and she did end up going into inpatient treatment and is in counseling today. Without this class, I never would have been able to help this young lady find the professional help she desperately needed.
Donating to the Mullins Charitable Fund really helps make an impact in students' lives and helps their education be more well-rounded and more complete. And if they don't have to worry so much about the expenses, then they can focus more on school and the other aspects of their life that are important.
That money could push them over the edge and say, oh, now I can go to school again.
The Mullins Charitable Fund will help support and educate, I guess, the mental health first aid here in the community.
And I think if each of us who takes the class goes out and only is able to help one person in the community or in our families, then it's worth it.
It's time to take a stand.
It's time to provide mental health intervention training for people working with at-risk youth.
It's time to educate our future healthcare workers.
It's time to build stronger and healthier communities.
You can make a difference.